My name is Dr. Mohana. I'm a pediatrician. I'm 35 this year and I work at the Parkway East Pediatric Clinic, and this is at the Parkway East Hospital.
Hello, I'm Stephen, Senior Consultant from the National Skin Centre.
Hello, I'm Ting, and I'm a pharmacy technician from National Skin Centre.
Tell us a bit more about your job.
I'm currently rostered to NCID Screening Centre Pharmacy, and my main job scope is to process prescription, pick and dispense medication to patients.
I look after sick children who come into the hospital and the clinic every day. And I really enjoy my job because I like dealing with children and I like making them better. And they bounce back to health really quickly, and that's really fulfilling for me.
Before COVID, I was mainly taking care of patients with chronic skin diseases. However, since April, when the COVID situation worsens in the foreign worker dorms, I was deployed out to the National Healthcare Group headquarters as part of the multi-agency task force to bring medical care to where the foreign workers are in their dorms. The work there has been tough, but I'm motivated by the simple realization that what I'm doing today will help to improve the situation in Singapore, and I will always step up if my country needs me.
How has your job changed in times of COVID-19?
So with COVID-19, I think especially with the circuit breaker measures and everybody being a lot more conscientious with measures to protect themselves, we are seeing a lot less sick children as well. So a lot less children with fevers or coughs or runny nose as well. So I see a lot less patients every day. So that's good in a sense because everybody's health is a lot better. But I also see a lot of fear. So children who do need help, who still need their immunizations and vaccinations, are not coming in because parents may be fearful about them contracting something if they come outside. So these are things which are still important, which they still should come in for to also protect themselves.
Now I have to work shifts with full PPE and also take extra precautions so that I do not bring the virus back home.
How has the situation impacted your relationship with your family?
So I stay with my husband, myself, and my two young children. My husband is also an essential worker, so we both go out to work during this period to help sick people in our hospitals. And so as a result, our children are also still going to preschool. I'm very grateful. There's still teachers helping to care for them while we go on with our daily services. We try to stay away from our extended family, so we don't go visiting the grandparents as much. We try to use FaceTime.
Do you have a message you would like to share with them now?
The message to the family is that I always wish that they would stay healthy throughout this period, which is really high risk because they're the most important people to me. So even if I am at risk, I'm not as worried as if any of my closest family members were to fall ill. Yeah.
What keeps you going every day?
Being a medical professional, we've come into this job wanting to help people, and there's no better time where people need help and that we can assist than a pandemic situation. So I really do feel that I need to step up and do whatever I can to assist people who are sick.
On a personal day-to-day basis, seeing the smiles and appreciation from the foreign workers' face gives me affirmation of what we're doing is meaningful, and that's what keeps me going.
What motivates me during this period is actually support from my family, friends, colleagues, and also seeing how I'm not alone with other healthcare workers, cleaners, delivery riders, and everyone else doing their part during this war. And also to travel after all this is over. Because I have to wear the PPE for 8 long hours at work is actually very challenging. So there was once I saw an elderly cry, and that actually made me ponder what if my loved one was in that patient's position instead. So that made the headache that came with wearing the PPE way less.
What are some of your fears, given the current situation?
So my greatest fear is actually having a patient who turns very sick. So as we know with the COVID-19 disease, sometimes the illness is unpredictable. So my fear is actually seeing a child who turns very ill or unwell. So although this is rare and we know that most children are well,
What is one thing that you've enjoyed during this circuit breaker?
the one thing I enjoy is actually a bit of quiet. So There's no more rushing. Everybody is a lot more relaxed in terms of a work-life balance. I think people are starting to learn that maybe they can slow down a little, and hopefully this continues even after the circuit breaker and after COVID-19 has settled down. Yeah.
What do you miss the most?
I guess I miss traveling the most because that's something I used to enjoy, experiencing other cultures as well as spending time away from work and with family in a different environment.
What is the first thing you want to do once COVID-19 is over?
I think we are all learning that we need to perhaps be a bit more flexible in what we plan to do. And I actually haven't planned ahead because I think if I had something in my mind that I wanted to do and I couldn't, then I might be disappointed.
How can we help essential workers like you?
So I think the best help is really to stay compliant to the measures the government as well as healthcare workers like ourselves are trying to tell you. Every every number counts. So every additional patient we have who's COVID positive is taking away time from us, from our families, from rest. And it's not an easy task to need to work 12-hour shifts, 13-hour shifts, wearing full protective equipment. So if you are responsible for lowering that numbers, I think we are going to be a lot more appreciative than actually gifts or food or flowers, right? Or just in or just words of appreciation. I think the actions would speak a lot better, and we'd really appreciate that.
Do you have any messages you'd like to share with the general public?
I've personally witnessed how Singapore is doing our best for our foreign workers who built our country. We are doing everything we can for their health and welfare, and we'll continue to take care of them and provide them with the care that they need.
Because this is a new virus, we're learning new things about it every day, and we don't want to do things which we regret, right? Even if we don't fall ill, if we are the reason why someone else has fallen ill, very, very ill, in fact, then it's not something we're going to be able to live with a conscience. So be vigilant, be responsible both for yourself and the people you live with and who are around you. Yeah.
Message to the public would be thank you for playing your part during this period. We will see better days ahead and we'll go back to our normal lives again, fighting.
Thank you, healthcare workers.
Thank you so much for letting me share with you, and I hope this makes a difference. Thank you.